Good morning. My name is Dr. Hillel Mazansky and I specialize in medical hypnotherapy, guided visualization, nutrition and exercise, my website being gianinc.com. Today's health tip is entitled, Doctor, are my hormones out of whack? This is a very common question that is asked by many patients, mainly if they're feeling out of sorts or they're feeling tired, they've gained weight, and it is ruled out in the vast majority of cases that there is no hormonal problem. The hormonal problems that do exist, the most common type is diabetes type 1 and 2. Type 1 comes in young children and young adults and is due to a genetic defect, while type 2 is found in the elderly due to being overweight, overeating, eating high sugar foods, etc. The most common, besides diabetes, that we do see is hypothyroid or underactive thyroid. That is not very common, but is next to diabetes is the most common one that we find. And there, the blood level of thyroid is decreased. The patients complain there of weight gain, of lassitude, tiredness, and not being able to get going. The contrary to that is hyperthyroid, which is far less in incidence. And hyperthyroid, the patients lose weight, they have a fast pulse, the heart beats fast, and their eyes may become protuberant. Other hormonal deficiencies or abnormalities occur during a female's menstrual period because there is fluctuation of the estrogen and progesterone and gives them the signs that they have and symptoms during their menstrual period. The contrary to that is postmenopausal syndrome that comes in the elderly when their estrogen and progesterone start decreasing, and then they get the hot flashes, the weight gain, and irritability. There are other hormonal deficiencies in infertile couples. Oftentimes, where there is no anatomical abnormality in the tubes, in the uterus, with the male sperm, it is usually due to hormonal deficits in the female, where the hormones come from the pituitary gland, the follicle-stimulating hormone, and the luteinizing hormone. And males can also suffer from hormonal deficiencies that lead to infertility. A man, as he ages, the testosterone level decreases, and this can lead sometimes to decreased sexual activity and tiredness and sometimes weight gain. When there is a definite shortage or overactivity in the hormonal gland, then and only then is supplementation or medication used. But by and large, the vast majority of people who complain that there's something wrong with their hormones, when you do a blood analysis, we find them to be normal. There is one other so-called hormonal deficiency that's out there, especially amongst the naturopaths and alternative medicine people, and it's called adrenal fatigue. Now, the adrenal gland are those two glands that sit above the kidneys and secrete certain hormones such as cortisol and adrenaline, etc. And they talk a great deal about adrenal fatigue and supplementation. This, however, is not true. The only true adrenal fatigue is called Addison's disease, which is extremely rare, where there is a decrease in the cortisol level. So in summary, we can say that the vast majority of people who think they have hormonal deficiencies, the vast majority of them do not, and it's up to the physician to find another cause for their symptoms. My name is Dr. Hillel Mazansky, and I thank you for listening to this video.